health of your body. It could show some signs of nutritional deficiencies or some systemic disease that your body has come down with. Today on Health Watch, our focus is oral hygiene. Plus, on the life on the web, bring you a feature on stress. My name is Nkem Okibe, and trust me when I say it's my pleasure to always do this with you every week. So go on a short break and we'll be right back. If you're just joining us, the program is Health Watch, reaching you on NTA Lagos Channel 10 station for excellence. And our topic today on the program is oral hygiene. With me on the program today is Dr. Azuara Ifeanyi David. He's a dental surgeon. You're welcome to Health Watch.
A pleasure having me.
Now, talking about oral hygiene, what are the basic things we should address, we should be looking at?
Well, basically, oral health is a sum total of the wellness of your mouth, which includes the teeth, the tongue, and the surrounding soft tissues in the mouth. That's what makes up the oral health.
You agree with me that the kind of dentition you have can influence your confidence and your self-esteem. So is it a hereditary thing? Is it something that you get from your mother? Is it genetic? Because you find that you see some very beautiful looking children.
Exactly.
And the dentition is, oh my God. And then you see some that are not very fine facially, but they have very beautiful dentition. So what would you say are the factors responsible for the arrangement of your teeth?
Oh, well, there's a lot that has to do with teeth arrangement. The final result of what you see in patient has to do with factors like hereditary, like accident, like delayed loss of teeth, and then trauma, accident, and some other things that could happen. But when the teeth is not normally shaped, the patient first presents to the dentist. It's up to the dentist to find out the root cause of this malocclusion or distorted arrangement of the teeth. But there are answers to all of these problems to put the patient back to his smiling ways.
If I come to you and say, I have a problem with the way my teeth is in terms of size and arrangement, what is the solution to that?
The patient will first have to understand what is called a normal occlusion or the normal arrangement of the dentition.
Is this a normal arrangement?
This is a normal arrangement.
Okay.
In a normal arrangement, we expect the upper teeth to lap the lower, to lap over the lower set of teeth.
To lap over?
To lap over it. But you see, the ideal arrangement is a situation where the patient has either inherited factors from parents or has had an accident which was not properly fixed, or apparently has had a history of delayed loss of primary dentition, which ultimately will affect the positioning of the permanent dentition. It is the work of an aspect of dentistry called orthodontics. The orthodontist is the specialist dentist who will ensure that the arrangement you have in your occlusion or the way your teeth is arranged is sorted back to normal. But there are equally other things that could be done in dentistry to ensure that occlusion gets back to normal.
Okay.
We have things like we call crowns when it's not so bad, or when part or parcel of the tooth has chipped off. A crown can be put on such a tooth, or even a normal filling can be done where the patient cannot afford a crown, to bring the tooth back to its normal position. So a lot can be done when the patient visits, yes.
On the break, when we return, Health Watch continues. Trust me, you don't want to miss this week's episode. Right. Alright, so just joining us, the program is Health Watch. and we're talking about oral hygiene. My guest is in the house, Dr. Azuara Ifeanyi David, who is a dental surgeon. He happens also to be the founding father and the former vice president of the Association of Private Dental Practitioners Nigeria. Before we went on that break, we talked about a lot of things. And one of the things we talked about was arrangement of the teeth. And there's a model here that has this. What's this? Tell us about it.
Well, this is one of the study models we have to educate the patient on what can be done when the arrangement of his teeth is not standard or is not normal to him. It's not normal. Where the patient feels a lot more deficient in terms of exposing his oral health, or where he has had, like I said earlier, delayed loss of dentition, leading to the growth of his permanent tooth in an abnormal position. So this is a model just illustrating what I said earlier.
Okay. So what's this called?
In terms
what's
of
this
well,
wire like?
these are the common tools that the orthodontist will apply on the patient in order to correct the malocclusion associated with cases of deranged or imperfect arrangement of the dentition. So this is called braces to the common patient. Yeah.
Does it hurt? How long should the patient be on this?
It all depends. The orthodontist will advise the patient on the duration of stay of this appliance, and equally when to come for checkup. But it's one of those things that is very mouth friendly, not painful. You can brush and do all your things with it, and you can actually explain it away to your friends and your colleagues. It's not something you wear and expect pain at all. It's quite accommodating.
Is there an age limit for one to use this? Because looking at this, one tooth is out. So how do you adjust this to cover?
One, there is really no age limit to orthodontic treatment, and for orthodontic treatment to be quite effective, there has to be space for to push in the tooth that is out of occlusion. So that might warrant one or two tooth removal or extraction in order to make a space for a desired movement of tooth into position. So it has no age limit.
Where does mouth odor come from? What are the major causes of mouth odor?
Mouth odor is quite a major problem to the patient. Good enough, the March 20th was actually celebrated all over the world as a World Oral Health Day. And the theme was Say Ah. Say Ah in the sense that we want a full patient who is confident about his smiles, confident about his association, and confident about his self-esteem, which actually begins with the mouth. So, to us in the dental profession, mouth odor or halitosis is quite a major concern. The answer can be neither here nor there. In few cases, mouth odor can occur, or the commonest case, it can occur as a result of very poor oral hygiene. Such cases are quite easy and straightforward to handle, where the patient has built up plaque, very poor oral hygiene, will not brush the normal number of times, has some other habits that maybe have to do with the kind of food or food he's exposed to, or the kind of drugs he takes. Most of these things could have subsequent, they are consequences in terms of bad oral hygiene and then bad breath or halitosis. But beyond this, where these problems have all been addressed in the patient, there are equally cases where it's actually beyond poor oral hygiene. In such cases, we see a patient who has maintained a very standard, very robust, good oral hygiene, but still has to come back to the dentist complaining about halitosis. Such cases could be multidisciplinary approach. In other words, the dentist might see the patient and could refer the patient to his internal medicine expert or other medical specialties to have a look at such case as such a patient. As poor oral hygiene alone does not really constitute a patient having halitosis. There could be medical reasons for a patient to come down with halitosis. The commonest in our environment is diabetes, where the patient has raised blood sugar and come down with ketone breath, which can give rise to halitosis. But there are equally some other abnormal cases which the patient may have to visit other discipline in the medical field in order to get a sure answer. But cases of halitosis originating from the mouth can easily be taken care of by the dentist.
So for someone who has had a mouth odor for years, has been to several, some of them have even traveled out of the country and they've gotten some form of medical attention out there, but they come back and they still have this mouth odor. What are the ways to manage it?
Well, mouth odor can, where you have had series of exposures to various experts and the complaints are still there, there are very common things we ask the patient to do. One of such is to ensure the frequency of chewing, like sugar-free gums. Chewing will ensure the production of fresh saliva. Fresh saliva has a way of wetting the mouth and ensuring that the patient has a degree of fresh breath. You know what happens to you when you sleep overnight, mouth is closed, everywhere is shut. You wake up in the morning, there is a degree of bad breath or halitosis. That is equally what we expect from most patients that have halitosis ordinarily in the day. They prefer to keep the mouth shut, worsening the situation. So, shutting the mouth down and chewing will increase the rate of production of fresh saliva. Fresh saliva will go a long way in ensuring that the patient maintains a degree of freshness and then decreasing the degree of halitosis.
Yes, today's topic is really interesting. I'm sure you'll be forced to smile. Someone like me, I love to smile like this. Alright, doctor, let's talk about the major causes of some dental issues. Like you find some people that have stains in their teeth and they tell you, for someone like me, I like to take some kind of tea. And I don't know if that is scientifically proven that it's a kind of tea that will give you some marks and stains in your teeth. And let's talk about smoking too and what it does to the color of the teeth.
It's actually not a very bad thing for you to have a habit like taking tea, coffee, and all those stuff. Even some medications, some oral tablets containing iron are known to cause stains, tooth stains. But the ideal thing is that stains are not things you can forcefully rub off from the teeth. Using a very hard object to rub off those stains will cause more harm because you're actually causing cavitation or marks on the surfaces of the tooth, which will worsen the situations. So what we expect is that maintain your habit, visit your dentist, ensure you visit twice in a year, or maybe 3 times, as the case may be, depending on your frequency or habit. Stains can easily be removed in the dental clinic by simple procedure called scaling and polishing. It's not painful, it's not invasive, it's something the patient can be friendly with, and then equally have to maintain his very good habit.
Thank you so much, Doctor. But before you leave, I would like you to show us the proper way to brush our teeth. You know, Health Watch is a general health program that focuses on women, men, and children. So just show us quickly what the right way to brush our teeth.
The right way to brush your teeth actually begins with this, the brush. The brush must have very good packed bristles, must be soft to touch, must have angulated ends so that it can easily get into the mouth, and must be within a sizable, the brush area must have to have a very sizable area. The moment you have a brush that is pointing accusing fingers on you, it's time to change the brush. So an ideal brush should last you 2 to 3 months, depending on the frequency, must have very soft bristles, and must be comfortable enough for you to hold. So ideal brushing begins with this. Now you have an ideal brush. Next step is application to the mouth. Now, the commonest thing people do in terms of brushing is to put in their paste and then off they go. Brushing is not a battle. Neither is it a battle between your brush and your teeth. It's actually a friendly disposition. So why don't you put in your paste, open your mouth a little bit, start on one particular section of the mouth with a gentle stroke up and down movement. Up and down in the sense that it gently will massage your gum and then get in between the teeth and down. So you do that on the lower, take it on the inner side of the same side, the same up and down movement, gently, and then you repeat the same frequency on the other side. Ideal brushing should take 2 or 3 minutes. Mouth friendly, can be first thing before breakfast or first thing after your breakfast, depending on your disposition, and then last thing before you go to bed. So, brush 2 times daily, first in the morning, and then at your PM. Remember, brushing should be AM and PM, AM and PM, up and down. Not a battle, but a gentle touch. Your tooth will be happier and like you for that. Thank you.
Thank you so much, Dr. Fine, for coming on Health Watch. You've said a whole lot today, and I really enjoyed this last part.
A pleasure.
Up and down, and it's not a battle. Thank you so much for coming on Health Watch.
Thank you.
Up next in the Life and the Word this week, we're looking at a feature on stress. We'll be right back.
Stress is a feeling of emotional or physical tension. It can come from any event or thought that makes you feel frustrated, angry, or nervous. Stress is the body's way of responding to a challenge, a demand, or a threat. When stress persists and you continually operate under emergency situations, the mind and body can pay a price for it. Different human beings respond to stress in different ways, in that what might be a form of stress to one person might not affect the other person. Talking about the causes of stress, We could have the external causes and the internal causes of stress. External causes are most of the things that one can see and you can easily relate to it, and this can be a major life challenge like losing one's job, marriage and having to raise a family with children, moving to a new environment, or even for some people the transition from the teenage years into becoming an adult. Other external causes of stress can be having a hectic work schedule or school, could be from financial crisis, divorce, losing a loved one, or having chronic illnesses, and even retirement for some people can also be a form of stress. Some individuals that are not very flexible with life situations, people that have rigid thinking, that might also cause them a form of stress, in that they might not be able to adjust quickly to certain situations that may arise. And these signs and symptoms can be in form of a cognitive symptom, it can be emotional symptom, physical symptom, or behavioral symptom. For the cognitive symptoms, you may have an individual showing poor judgment to situations, not being able to handle situations or have a good say when being asked to give a judgment on a particular situation. Then also the individual might also have inability to concentrate, constantly worrying about situations at hand, seeing only the negative aspects, and also being constantly anxious. Then going over to the emotional symptoms that might be seen in a person who is being faced with a lot of stress. Number one, you can have symptoms of depression. And the person having repeated feeling of unhappiness, moodiness, being irritable at the slightest instant, showing excessive anger to little things. Sometimes an individual might even be lonely and always staying in isolation, or you may have somebody being easily agitated. For the physical symptoms usually are some of those symptoms that mimic a particular illness. So the person might be having symptoms as if he's actually sick, and it might be confusing to say that okay, it's because he's facing stress, or it might be that he or she is actually sick. One of the major ways that has been seen for one to cope with stress is having a good social support system in the form of close family relationship and having good friends. And people can really rely on this form of method of coping with stress, in that the person would have built a good relationship, would have built a sound relationship with those individuals, so that when situations arise, you can have people to turn to, you can have people to call to your rescue. Also, another way of coping well with stress is having your financial savings. Savings is good in such a way that when financial crises occur, you can have something to fall back on, you can have a reserve, so you can go to withdraw from there to take care of those challenges that arise. Also, building the right sense of control. By this, I mean being able to handle situations, not running away from challenges. Then also finding a way to relax and rest too is also a way of coping with stress, like finding time to go on holidays, taking time out for recreation with family, friends, and people you cherish too can go a long way in helping to cope with stress. Then finally, I also want to add that eating healthy diets would help you build stamina, so that when you have stressful situations, the body can withstand it and the immunity would not fail.
And that's it for this week on Health Watch. Remember that health conscious people live longer. And remember what doctors talked about today. Brush twice daily, early in the morning and before you go to bed. don't battle your brush. Gently up and down, and that's how it goes. Send a mail to us on akibencare@gmail.com, healthwatch8810@gmail.com. Send the text over to 07060865487. My name is Nkem Okibe. See you next week.